All right, can I talk to you while you're doing this? How many is this? Is like the third set or the second set?
Third.
So this would be 30 push-ups so far today.
Yeah.
I don't know, Tim.
Yeah,
We're gonna have to
Dr.
consult the
Rourke.
video. I don't know if you did a full 10 there.
You
Dr. Dr. Rourke's making progress.
She heck yeah.
Doing man push-ups.
A little bit.
All right. Sophie?
Sophie runs
You gonna-
every day.
Hit-
I ran 4
Wait a
miles.
minute.
Drop and give me 10, girl.
Let's turn that camera around and see what you're.
There's a couple of ugly warning masses on the back of this poodle's ear. I know this is something that happens to poodles when they get older. Usually they're not cancerous, but especially right behind the ear, they're mad up and they like to scratch at them and dig at them and make them bleed and they can become infected. So we're going to take those off. We're also having some dental work done, so let's see. This would be four. Yeah, we'll have to take some x-rays to see the health of those teeth.
Yeah, I think we should get one. Unless
That looks good.
knows where
It's
they're
missing one tooth there, but the roots look very healthy. We have a little pocket beside it, and it's a little more mobile than the rest. It's very hard to sign on these incisors, and it's questionable on the x-ray as well. But all these incisors have a little movement. It's normal for a dog to have that, but this one is infected, and it needs to come out. And if we can get the infection out of that area, it'll save these other two teeth. So the nerves that feed this tooth come from back here. So I'm going to put a nerve block right here, and we'll let that sit for 10 minutes. I don't know if you'll be even able to see it, but I'll put it right where the nerve comes out of the bone here. Put a little bleb of bupivacaine, and then we'll rub it in. And it's going to block that whole quadrant, so she won't be able to feel anything when we go to remove that tooth. Take a look at this tooth. We just touch it with this probe. I don't know if you can see that. Yeah, it's moving. So, if it's mobile like that, that means there's 3 roots in this tooth. And for it to move, those 3 roots are splayed out in a different direction. And for it to move, those roots have to really be loosened up. So she's lost a lot of bone around that tooth. It's going to come out easily. It needs to come out. There you are. You can see from the side view, this gum line comes right up to here. And on this tooth, we have this much root exposed. From there to there is just root. You can see when I touch it, it's just moving. So it's nothing much but gum tissue. Soft tissue is holding this in place. So we'll make a little incision around it to loosen it up. Usually we have to section these teeth because the roots are splayed out in different directions, but this one is so loose, if we just put a little pressure on it, loosen up those periodontal ligaments that are still attached, they'll give way. We'll just hold the pressure on it for a minute.
Look at that.
Look how normally the root is twice as long as the crown of the tooth, so this root has been eroded away and destroyed by the bacteria. And these roots are a little longer on this end, but they're not as long. They're almost equally as long as the crown. They should be twice as long. So the bacterial infection's just been eating away at them and the bone around them. Lost my probe. So we want this to be 3 millimeters at most. I don't know if you see where that black line is. That's normal. So we watch the silver part could go up to the black line, but if we watch this, shoo, it goes way down in there, just disappears, and that tooth is moving. So look at that one. That one just wants to come out. He wants to come out on his own. We'll just gently encourage him to come on out. You can see how gray and dead that root is. The tooth wasn't doing any good to her. much attachments to work around it. Grip on it. Patience is a virtue. We're going to just put gentle stress on that and give it time to release. There it goes.
This little kitty has a pretty large palpable mass in his abdomen. Seems to be on the right side of his abdomen. We're just going to do a kind of a brief exam on him to see if we can find the main origin of that mass. This is the liver here. There actually seems to be some kind of nodule, brighter opacity there in the liver too, and as you see this dark is his gallbladder coming up. Okay, so this actually appears to be his kidney here, which is quite a bit larger than a kitty kidney should be, and it appears like maybe there's some not a nice crisp outline of that kidney like we would like, so not surprising there. We can save some images of that. Again, here's the kidney just in a different view. Again, quite a bit larger than we want to see, and it appears to have not good margins around it and some fluid there. That dark area around the kidney seems to be fluid. I'm pretty sure this is the origin of his mass, unfortunately. How much smaller that one is in contrast to his other kidney, but it still does not have the appropriate architecture when you compare that to what a normal kidney should look like. So even though it doesn't appear that this kidney has a mass on it, it's not appropriate detail to that kidney like it should be either. So anyways, again, we'll kind of for comparison, one kidney versus the other, but this kidney's more normal than the other one. So this one's more oval. You do see some of the cortex and medulla a little better outline, but it's still not, again, nice and crisp like we want to see. But as you see the difference, this kidney I didn't change anything on my settings, and this kidney more than takes up the screen.
I see the mustard on it. Okay. Yeah, it does. I want to make sure I get it. Okay. That's good.
Yeah,
It is spicy. I tasted it immediately.
spicy. A new client came in yesterday, and to make some changes or to feel confident about making changes, I want to know, what you guys are doing now. You're clearly doing a great job, right? Your Google review is super high, your Facebook review is high, and I'm guessing that's because you're a great team, right? You guys get up, you get it done, right? You guys do a great job. And then I looked at your Facebook page, and this is what the kinds of quotes you're getting, right? Great experience, they treat you like family, there's no cutting corners, state-of-the-art facility, exceeds expectations. A minimum database is the CDC chemistry and UA and fecals, right? For many clinics, it's fecals and 40X, right? Everyone else, I'll tell you what, right?
So we just finished our staff meeting on laboratory testing, and I think it was pretty good. I think we showed us a few things we can do more with our in-house laboratory testing and the tests that we send out to the lab. So there's a lot that we can learn from the minimum database we were talking about. So combination of blood testing, the physical exam, and the urinalysis together puts us. What do you guys think of the meeting?
I thought the meeting was very good. Emma and I were just talking about it, and it seemed, honestly, initially when they pulled up some of the slides, I was like, oh, this is a little bit more in depth than some of us need to hear.
Yep.
But I think that it caught everybody's attention a little bit better, rather than just the same mundane. This is why we need the lab work. We need to talk to the people about lab work. So I think showing all of our staff the importance of the lab work and some examples of dogs that looked perfectly healthy, and an example of them not being healthy on the lab work, I think was great.
Yeah, and I think we're getting a lot of good resources out of it too. Client handouts, things that we can put into our training folders, which can help us get more educated, which can help us educate the community. So I think it was really good overall.
Yeah, so it's really good. Tasha, how you doing? You feeling better? Still a little drunk after her procedure. Can I take a look at your spots? Can we look at your spots? There's a little spot above her eye. And there's a couple behind her ear, so it looks good.
Good girl.
She's a little drunk. We got lots of pain meds for her, so she'll sleep it off tonight and she'll feel a lot better tomorrow.
So it's very common.
There's the... What is it? He gets... Oh, you saying it. You saying it. Oh, hello. You are... Oh, Boozy. It just smells bad. You can't eat it.